What do addiction disorders or substance use disorders have in common with mental health disorders? And the short answer is just about everything. There's social or interpersonal functioning that is impaired or absent as a result, like work obligations, school obligations. You make decisions that are sometimes risky in both circumstances. Impulse control can be impaired. So many of the factors are definitely overlapping. And then physical consequences of both mental health and substance use disorders can be pretty profound as well. Things like problems with your lungs, you can develop heart-related problems. There are mental cognitive problems that you can develop as a result of both. So they have a considerable amount of overlap. So how do substance use disorders and mental health disorders differ? Probably the single biggest thing is that substance use disorders, part of their criteria and something that's almost always part of the disease is the tolerance and withdrawal. Somebody who's been using more and more drugs or alcohol for an extended period of time, by definition, will require more and more of that drug or alcohol to get the same level of effect. That's called tolerance. And if you take that drug away, you'll have an elevated heart rate, sweating, anxiety, agitation, high blood pressure, but it can also be psychological, severe dysphoria, depression. With certain drugs and alcohol over long periods of time, if we take somebody and we put them into a functional MRI machine and look at their brain, you'll begin to see areas of the brain that are have definitely changed or are lighting up differently. And we don't see that to the same extent with people that have mental health disorders. On the other side of that sort of equation is some of the things mental health disorders, they're not nearly as correlated or associated with substance use disorder as a substance use disorder is with having a co-occurring mental health disorder. So those are probably like the main features that differentiate the two. So co-occurring disorders, otherwise known as dual diagnosis, is when you have a distinct mental health condition and a substance use disorder at the exact same time, and both meet criteria independently of one another for those conditions. And again, with substance use disorder in particular, having a co-occurring mental health disorder is very common. Effective treatment is treating both of these things at the same time with medications, whatever behavioral treatments are most appropriate for that given condition. So for example, if the patient, one of the reasons they have severe depression is that they have a lot of childhood trauma, you're going to want to treat the depression with medication. You're going to want to treat the childhood trauma with therapy that is specific to having past traumas. So you're treating both simultaneously, while over here you're also treating the substance use disorder, maybe it's alcoholism that goes along with that. So treating them all at the same time is by far and away the most effective means for treating co-occurring disorders. Is substance use disorder considered a behavioral issue? And the answer to that is definitely. By definition, as a matter of fact, there are 11 criteria that we use to diagnose a substance use disorder. And based on how many of those criteria you meet, you'll be mild, moderate, or severe. So 6 or more of those criteria, you're characterized as having a severe substance use disorder. And these criteria are broken down into like 4 categories. And 3 of the 4 categories are all behaviorally related. And they're impulse control, social impairment, and risky or hazardous drug use despite consequences. The 4th category is physical, tolerance and withdrawal. But those other 3 categories are all behavioral, and so to answer the question, yeah, absolutely, it is a behavioral disorder. What are some barriers to treatment for those who have co-occurring disorders? That's like a topic unto itself because there's a lot of answer to that question. Oftentimes when we're treating patients who are early in recovery, they have a lot of symptoms of mental health disorder that are substance use related. And we can't figure out whether or not these are real depression and organic depression and anxiety, or they anxiety and depression because they're in withdrawal and we're weaning them off drugs. So it can make diagnosing and treating very, very tricky for us. Mental health disorders are not looked at the same way as like physical health disorders. They're treated differently. They're stigmatized. The amount of funding and reimbursement for providers is lower. And so as a result, we don't tend to treat them on par with other medical conditions, even though they are medical conditions. And unless you treat all these things at once, you're just going to have a lot of relapses and a lot of failures. That's why a lot of people think that, the individual using drugs just doesn't want to get clean. They're not ready. They haven't hit rock bottom, right? Well, part of the problem is how are they going to get clean if they have, no ability to house themselves, to get around, to get a job, they have legal problems. Those create significant stress in someone's life. And if somebody who's early in recovery that has a ton of stress and a ton of problems, they're almost going to have a ton of cravings, and they're going to use the first chance they get. So you set them up for failure. You call it a moral failing, you say they're not ready, but in reality, you haven't given them effective treatment and allowed them given them a high probability of succeeding.
What would you tell someone who's watching this video and on the fence about seeking treatment?
Get off the fence. Don't be afraid. Come make a phone call, ask questions. We look at treating mental health disorders and substance use disorders exactly the same way as I treat people that have diabetes or high blood pressure. These are medical conditions that have very effective treatments available. The difference is that physical conditions don't have the stigma associated with them that mental health and substance use conditions have, and people feel like they're going to be judged if they ask for help. That's absolutely not the case with our clinic and the treatment programs you work with. There's zero judgment, and we just want to provide information and education to people and let them know they're not alone, and that are very effective treatment options for a multitude of mental health and substance use disorder conditions. You just have to ask for help.